My understanding is that once the catheter is removed, all men will have access to pads to help them with the containment of that incontinence initially. So tell me a little bit more about the pads that are available.
Okay, you can have up to 4 a day, and the pads that we provide are shaped like this. So they come in a packet of 28. And when you leave them in the packaging, because actually the packaging protects the pads from becoming absorbed with moisture, so it's actually like a protective coating on the packaging. So always keep them in these packages. Don't put them into damp bathrooms or into an airing cupboard where they'll dry out. When you take them out of the packet, they're folded quite firmly, so it's a good idea to open them up and fold them in half to make them into a well shape, like so. And you wear them with close-fitting underpants.
Right.
Okay, so boxer shorts are not really ideal. They need to be close-fitting underpants, wide fronts, something like that, because they need to be worn close to the body to be effective. The top layer is like a stay-dry liner, so any urine that goes into the pad is wicked away from the top sheet, so it keeps the skin intact and keeps the skin dry. They come with a sticky back, so take the sticky back off the pad and then press it firmly into your underwear and wear it obviously close to the body like so. This is a pad that we can provide you up to 4 a day initially. If you need a more absorbent pad, then we do go up a size. This will hold approximately 250 to 300 mils of urine. But if, for instance, your leakage is much severer to start with, then we can go up an absorbency, but it's a much bigger pad.
That is quite a bit bigger, isn't it?
It's a bit bigger. Yes, it's massively
a
bit bigger. It hasn't got the sticky back on it, but it is a pad that again you fold in half into a well shape and wear in close-fitting underwear.
So if patients are getting better from a continence point of view and they find that pad's a little bit too big or a bit too bulky and not great, is there anything else that they can have then?
Yeah, there is. We can go into a much smaller pad that's designed more anatomically shaped for men actually, so it's a nice little triangular pad. This will hold about 150 mils of urine. Again, it's got a sticky back on it, so you can peel it off and fit it into your Y fronts and wear it close to the body. It's got the top sheet again that keeps the skin dry. So men do get on really well with these, but they're not quite as absorbent as these, but brilliant for when you're starting to get your continence back. When you have your pads delivered, you'll have a 13-week delivery, so it is quite a large supply in one go, but you are allowed up to 4 a day, and you should have that supplied if that's what's been requested. When you need to order more, there will be a letter inside your delivery package with a telephone number for the continence service. So about 2 weeks before your delivery date is due, give that telephone number a ring, it's the continence service, and they will automatically reorder you some pads.
So sometimes when men come to see me, they've got some irritation from wearing the pads. What do you suggest in that situation?
A barrier cream is useful, and we suggest a water-based barrier cream, which you can obtain over the counter at any chemist. Don't use an oil-based barrier cream because that just tends to block the pores of the pad, so it does need to be a water-based barrier cream, and apply it quite sparingly. You don't need to put it on too thickly. Also talcum powder, you can use that, but again a very light dusting.